Right, well, let's start then. And hello, and thank you very much for joining us for this webinar called Graduated Driver Licensing, an Australian Perspective. Now, the background, road safety organisations in the UK are renewing calls for the new government to introduce a graduated driver licence that would put limits on the number of same-age passengers new drivers can carry for a certain period after passing their test and other specific restrictions. How could that work? How might it help bring down the casualties? Where can we learn from? And what needs to happen to have a realistic prospect of GDL being approved, adopted in this country? So in the coming 60 minutes, we'll hear from Dr. Sarah Jones, a long-time advocate of graduated driver licensing. So I'm going to show you that. Yes, Sarah Jones will be from Public Health Wales, where she's a consultant. I first met Sarah on the professional circuit in 2012 at a TISPOL conference in Edinburgh, where she was enthusiastically presenting the idea of graduated driver licensing. It had great support from the then ACPO Chief Constable, Suzette Davenport. So we'll see what's happened through Sarah's lens shortly. Sarah will then be followed by, oh, look, there we go, Dr. Shaun Helman. Now, Shaun will be, there's a recorded part of Shaun's input to this, but Shaun will be around for the entire hour to take part in conversations and discussions towards the end. We also, about half an hour ago, I received a recording from Jonathan Passmore from the World Health Organization. He was traveling, or is traveling this morning, so he's not able to be with us, but he will be specifically looking at the importance of restricting alcohol as a specific element of the graduated driver licensing mix. But let's start with Bernard Carlon, who is the Executive Director for the New South Wales Centre for Road Safety. We're thrilled to have you here with us, Bernard. Thank you so much for joining us. Over to you to introduce your perspective on graduated driver licensing.
Right, thank you, James, and welcome to everyone. Hopefully you can hear me clearly, and I'm just about to share my presentation. Firstly, it's customary for us to acknowledge the Aboriginal land that we're on in New South Wales, and I'm on the Darkinjung people land, and pay my respects to elders past and present, and acknowledge their custodianship of the land and waters in Australia. And note that in our Indigenous community, they're 2.5 or more than 2 times more likely to be involved in a fatal crash in New South Wales. And we're working very closely with our community to try and address that particular issue in New South Wales. I'm going to cover off on our New South Wales Graduated Licensing Scheme. It's part of a national framework in Australia. And I'll talk a little bit about the national framework when we get to that particular point. But the key for the creation of the graduated licensing system in New South Wales really was around the research that showed both age-related and experience-related factors contribute to the overall representation of young driver crashes and their involvement. But this is not just about their age, but also about the complex cognitive abilities that are required to actually control a vehicle. And so what we do know is that drivers tend to learn those basic car control skills relatively quickly, but the more complex cognitive abilities involving judgment and risk assessment, the decision-making that enables a novice driver to be safe across a wide range of potential hazardous situations takes significantly longer for them to actually achieve. And gaining extensive driving experience that begins with very low risk situations and gradually increases the complexity as a driver becomes more experienced and acquires more skills is regarded as the optimal approach to learning as you go through your experience in becoming a more competent driver. So young people have a higher crash risk due to the nature of adolescent development and its effects on young person's cognitive and perceptive skills. That lack of driving experience, the poor ability to anticipate and perceive, identify and therefore react to hazards on the road, and the failure to recognise and assess risk as well as the propensity to take intentional risks, and that propensity to be overconfident as well and overestimate their driving ability. And they also are a group that's strongly influenced by peer pressure. And so the system in New South Wales is a 3-stage system. You get your learner license, and we gradually release some of those constraints on people as they go through the graduated licensing system. So in that first period, learners must have a supervising driver present when driving at all times, must be displaying their learner plates. They must do that supervised driving for up to 120 hours. And they must also have, in New South Wales, 10 to 15 hours of nighttime driving. There's a speed limit of 90 kilometres an hour whilst you're on your L's. A very low demerit threshold. So we have 13 demerits. If you lose 13 demerit points on your licence in New South Wales, a full licence, then you get a suspended licence. For L plates, it's only 4 points. So really any infringement leads to a suspension of their licence. No mobile phone use, and also a 0 blood alcohol. So you can see that period where you must be totally supervised in learners is actually one of the safest periods that we have in our driving career, when you're on the roads in New South Wales. And so when we have a look at the next level, so after you've done that learner period and you've completed the 120 hours and you can get that license at age 16 in New South Wales. You can't go to the next level until 17, and you must have completed those either 120 hours, or I'll mention a safer drivers course, which has also been introduced, which has a 20-hour discount. So that next level is 1 year on your red Ps. And so on the red P level, it's a 1 year period. Speed limit is 90 kilometres an hour. Again, low demerit threshold points of 4 points, no mobile phone use, 0 blood alcohol. And this is where we start to introduce, because you're now independently driving, no high-performance vehicles and passenger limits, as well as the vehicle that you passed your test in. If it's an automatic vehicle, that's the vehicle you're restricted to driving. If it's a manual vehicle, then you are able to drive a manual vehicle in that P period. So this, again, there are passenger restrictions which apply in New South Wales. So you're only able to drive if you're under 25 and on your Ps. You must not drive with more than one passenger who's under 21 between 11 p.m. and 5 a.m. So then the next level that we go to is the green P, which is a 2-year period. And again, now you can see the speed limit is slightly increased to 100 kilometres an hour. The demerit point threshold is now up to 7 points. Again, no mobile phone use at all and 0 blood alcohol. The vehicle constraints remain, and the passenger limits also. Now, during this period, once you finish your 2-year period, if you've had a suspension of your licence, then your licence can be extended for a period as well until you can have a clean driving record and demonstrate that you have a responsible driving. And the next slide is actually about that Australian graduated policy framework which we have in place. And so we have range of states, jurisdictions and territories in Australia. New South Wales is one of those. And we joined as a federation to put together a framework so that some jurisdictions that are not yet at the exemplar level have standard, some minimum standards that apply, including sort of the age constraints, 50 hours of supervised driving, 0 blood alcohol content. And then each jurisdiction is slightly different and has an enhanced version of that up to the exemplar standard, which New South Wales is close to, but not quite there. Victoria has a 1 year age difference compared to New South Wales in being able to enter into independent driving. And so those restrictions on passengers, late night time driving, the L and P licence holder restrictions around mobile phones, low demerit points, range of educational programs are all critical to that exemplar. But this provides a framework where jurisdictions across the country who don't have particular elements are able to then have a look at the evidence from each of the other jurisdictions to then adopt those as they improve their system for young drivers. The journey in New South Wales started back in 2000 with a graduated licensing system of 50 hours of supervised driving. And so you can see the sort of the progress that we've made over time. And so we've introduced further educational programs like workshops for supervising drivers, for L plate drivers. Zero alcohol was introduced in 2014. And the high power vehicle restrictions for P platers in 2005. The Young Driver Advisory Panel was formed in 2008, 6, and in 2007 was where we introduced the 120 hours. The speeding laws for P2 drivers introduced in 2009. And in 2013, we introduced a Safer Drivers course, which is a once you've completed 50 hours of practical driving and you have basic vehicle control skills, then we have a program where there's peer learning within a classroom environment plus a guided exercise drive with an instructor and 2 participants. And so that course, when completed, gives you a 20-hour discount on the 120 hours. When we start to have a look at the results that have been achieved during this period, we can see that for the introduction at 2004 to 2008, when this structure of the 3 graduated periods was introduced, you can see here a significant reduction in the level of trauma that's being experienced as a result of the introduction of those conditions and the graduated system of reducing those conditions on drivers. And when we have a look at the actual involvement in fatal crashes, so that 5-year average number of young driver deaths per year before the introduction of a GLS was 94 on average, and that dropped to 42 in the most recent 5 years, a 55% reduction, which is just a significant reduction in the trauma associated with young drivers. And you can see here the rate at which all of those novice drivers, Ls and P drivers, were involved in fatal crashes per 10,000 has dropped from 2.3 down to 0.6 over that time period as well. And look, what we do know as well is that driver licenses, those who don't have a license or drive without a license, are significantly overrepresented in our road trauma, much more likely to be involved in fatal crashes. And so it's really important within the design of our scheme to ensure that people who are disadvantaged in getting their driver's license, and again, when we look at the Aboriginal community, we have around 50% of eligible drivers who actually have a driver's license compared to around 87% of the general population. And so supporting not just Aboriginal youth, but also refugees and other disadvantaged young people in our community get their driver's license. We've constructed a program that's run since 2015, which is a driver license access program run at a community level, contracted by Transport for New South Wales. And since 2015, more than 9,000 drivers have achieved their Ls and 7,000 have achieved their Ps in that context. It's a really important in terms of equity, but as well keeping people safer. We know people are much safer drivers inside the licensing system than outside. And we also, as I mentioned, introduced in 2015 the Safer Drivers program. Again, for learner drivers under 25, must have completed 50 logbook hours. And since 2013, 262,000 learners have completed that program, and currently around 35% of the total of around 280,000 a year that actually take part in that program. So that's a very quick overview of the graduated licensing system within New South Wales. As I said, it varies across different jurisdictions in Australia, but it has had a massive impact in the reduction of trauma for young drivers right across the country, but in particular you can see in New South Wales, where we contribute about 30% of the fatalities and just over 25% of the serious injury casualties within Australia. So thanks, James.
Bernard, thank you so much for that really interesting, and also big thanks to Siobhan Marin, who works with you and is doing sterling work, answering lots of questions on the text on the chat function as they're coming in. So that's brilliant. Thank you. Do stick around. We'll try and make sure there's time for some conversation towards the end. But let's move now from New South Wales to Old South Wales, and our next speaker, Dr. Sarah Jones. Sarah, welcome and thank you.
Thanks, James. Okay, attempt to make the tech work. Can somebody give me a thumbs up when I've managed to... There we go. Does that look good? Thanks, James.
Yeah.
Hello there. So, as James has mentioned, my name's Sarah Jones and I'm a consultant with Public Health Wales. And as James also mentioned, I've been talking about graduates driver licensing with Shaun, who's going to follow me for a good few years now. What I'd like to do is explain a little bit more about why I think it's not just a road safety intervention, but a much broader public health intervention. I've in the time I've been talking about graduate driver licensing, I've also been lucky enough to spend some time with Dr. Begg in Dunedin in New Zealand. And she and I worked together to actually create some estimates for the potential benefit of graduated driver licensing here in the UK. I'm not going to dwell on those today. What I'm going to talk more about is the broader benefits of graduated driver licensing. I hope we're in my there we go. Right. Okay. So, you can't fail to have noticed what's happened in the past few years in the global context. We've all suffered massive detriment to our health and well-being. And post-COVID, we find ourselves not just dealing with the post-COVID impact, but also the increasingly urgent demands of addressing the climate emergency. And what I hope to do today is demonstrate a little bit more about why I think graduate driver licensing is an important part of that post-COVID recovery, but also addressing the climate emergency. So you can't fail to notice that road traffic crashes have a direct impact on health, and health has an effect on road traffic crashes. And that's the immediate and obvious benefit that we talk about in terms of graduated driver licensing. And in the context of COVID, I think doing anything that we can to reduce road traffic crashes is critical to helping health and health services recover from what we've suffered during COVID. And this principle is lowering the baseline, if you like. It's preventing the things that don't need to happen. And I think Bernard has done a cracking job of demonstrating exactly why young driver crashes are ripe for being part of this lowering the baseline post-COVID agenda, because there really is no need for it to happen. We have interventions that clearly demonstrate that we can reduce the burden of road traffic crashes. But if we move away from the direct effects on health, we've also got significant indirect effects on health, and I've just listed one of them there, and physical inactivity. Because if I choose to drive places instead of walk or cycle, then that has a direct effect on my physical activity levels. But because of the threat that cars pose in our road traffic environment, it's also likely to mean that by me driving, I'm also discouraging other people from walking and cycling as well. I'm actually encouraging them to drive, and I'm encouraging them to be physically inactive. And as we know, the more people we have on the roads driving, then the more likely people are to choose not to drive themselves because they perceive that risk of walking and cycling is so high. So physical inactivity brought about by more people driving has a massive direct and indirect effect on our health, leading to obesity, cardiorespiratory problems. But by driving more and more, we are also exacerbating the climate emergency, and addressing particularly short distance is critical to addressing the climate emergency. And a change in climate also has massive effects on our health. Now, to go back to the young driver crashes and the direct effects, road traffic crashes themselves. This is a slide taken from back when I began talking about this, which is why you've got a very old date on it. I've got no reason to suggest that the profile has changed in any way. One of the reasons I'm particularly interested in is the red bar there, which is representing Wales. And we do have a greater young driver crash problem here in Wales than in Scotland or England. Historically, we have done. If you look at Northern Ireland, the historic problem is greater still. But the essence of the problem is the same everywhere. When you compare crash casualty and fatality rates associated with young drivers with the proportion of driver licenses held by young drivers, you can see that the crash rate is considerably greater than we would expect to see based on the number of young people driving. It's not right. It's something that doesn't sit right, is an inequality that's unacceptable. And in health, we're always seeking to address inequalities. Now, the reasons for this, Bernard has already touched on, is more or less down to age and inexperience, rather than it being people who are necessarily driving badly or irresponsibly. We know that plenty of model young drivers crash as well, just because many factors that Bernard has already alluded to. But actually as well, if we put that in the context of the climate emergency, we know that a really high proportion of the emissions in the UK are due to car and taxi journeys. A large proportion of car journeys are fewer than 2 miles, and those short car journeys disproportionately affect emissions and air quality, and disproportionately contribute to the way in which the climate is changing. And there is a perception amongst policymakers that if we can encourage more public transport use among young people, then they would continue to use public transport and active travel as they get older. And the importance of doing this is that we can see that as soon as young people learn to drive, their car use starts to increase dramatically and continues to increase through adulthood, and their active travel and their public transport use decreases. So if what you've got there is the average proportion of trips per person per year, and the vertical are the age bands, so you can see by the time you're in middle adulthood, you're at your peak car use, but that there is a decline, that the increase in car use increases from the 17 to 20-year-old age group upwards. At the same time, active travel and public transport use is decreasing. And I think that graduated driver licensing offers us the opportunity to address both the young driver crash problem and the issues of changing travel behaviours once people turn 17, 18, 19, 20 and start to enter into adulthood and start using cars more and public transport and active travel less, and the effect that this then has on the climate emergency. So as I think you all know by now, graduated driver licensing is an opportunity for newly qualified young drivers to gain experience of driving under conditions of reduced risk. And it does this, as Bernard's explained, by placing an intermediate phase between the learner and the full licence phase. Permission is granted to drive unsupervised, and DOT in New Zealand is really clear. We should always talk about permission and never restriction. And once people have passed their test, we give them permission to drive unsupervised, except for driving at night, driving with passengers of a similar age, or driving after having drunk any alcohol at all. They can do the first two, the nighttime driving or carrying passengers, if they're accompanied by a fully qualified adult who's also not had a drink as well. And I tend to liken this to a stairgate, again, thinking back to other things we do in public health, because we know when a toddler starts walking, there's a big gap between those first few faltering steps and that toddler being able to walk long distances without falling over. And so while they're learning that skill, we keep them away from the most dangerous places in the house. We keep them away from the fire. We keep them away from the stairs. What we're doing with graduated driver licensing is, in effect, putting in a stairgate for newly qualified young drivers. So the big question really from a public health point of view, from any point of view, is whether it works. And all of the evidence points to the fact that graduated driver licensing is overwhelmingly successful in reducing crashes, casualties and fatalities associated with young driver crashes. Back in 2013, I, along with Shaun, was involved in this TRL-led piece of work that concluded that the evidence that graduated driver licensing improves safety is compelling, and that driver licensing in Great Britain should be based on a strong graduated system. As I think you know by now, we don't have graduated driver licensing in the UK, and over the time I've been talking about it, and I think Shaun and I have probably got a very similar list here, and Shaun and I have had this conversation, we've heard any number of reasons why it's not appropriate for the UK. We've been told that just because it works in other places, it doesn't mean it would work in the UK. To which my response, of course, is, well, why wouldn't it? Why don't we take the chance and see? We're told that the police are too busy to enforce graduated driver licensing. James has already told you that the previous head of ACPO has supported graduated driver licensing, and the current head of ACPO supports graduated driver licensing because their view is it would be a welcome departure from knocking on the door and telling families about the loss of a loved one. We're told that it would penalise law-abiding teens, but we know that model teens crash too. We're told that it would hinder education and employment, but actually evidence from New Zealand suggests that this isn't the case, and actually the proportion of young people driving is dropping. And if only 25% of teens drive, then 75% of teens don't see that not driving hinders their education and employment chances. We're told that restrictions are unfair, but so is death on the road. We're told that restrictions won't be complied with, but actually we know that most people are law-abiding. We weren't all being watched through COVID when we were told to stay at home, but most people did that because that was what they were being told to do. We're told that more people will drive without a licence. Well, the cost of insurance is astronomical in the UK at the moment, and I personally think that the cost of insurance is probably a greater deterrent to driving with a licence in the current system. And we're told that young people would be unfairly penalised, but actually it's young people that suffer the biggest burden of young driver crashes. So yes, I firmly believe that graduated driver licensing is a significant public health intervention that will not only reduce the burden of road traffic crash casualties and fatalities on the UK roads, but that it will support our recovery from the COVID-19 pandemic, and that it will help us to address the emergency that is the changing climate in a way that will bring about significant change and improve health and well-being for all much sooner rather than later. Thanks, James.
Now, unfortunately, we weren't able to show the input from Jonathan Passmore of the World Health Organization in the live webinar, but I did promise to ensure that his presentation was included here. And so thank you for joining us for the recording. I'm very pleased now to introduce you to Jonathan Passmore, who looks specifically at the role of alcohol restrictions within a graduated driver licensing scheme.
Good morning, good afternoon, good evening, ladies and gentlemen, colleagues and friends, wherever you may be. I'm really sorry that I couldn't join you in person, but wanted to share some thoughts and some comments on a topic that is particularly close to my heart. To set the scene, I wanted to take the opportunity to remind our audience that someone is killed on the roads of the world every 26 seconds. This is a frighteningly stark statistic, but no statistic can ever do justice to the human face of road trauma, particularly our young populations. So when we think of road safety, when we think about those, when we think about the impact and the consequence of road trauma, let's always remember people like Tara from Malta, Darren from Ireland, Yannick from the Netherlands, and Tamir from Kyrgyzstan, just to name a few. For those of you who don't know me, I work for the World Health Organization, but before I joined the World Health Organization, I was based in Victoria, in the Australian state of Victoria, with the Transport Accident Commission. So for WHO, I'm the regional advisor for road safety for Europe, and WHO, we have a mandate for within the UN system to coordinate road safety, and the current focus for that mandate is the implementation of the Decade of Action, 2021 to 2030. All of our focus and recommendations are based on the safe systems approach. We have a very extensive catalogue of specific risk factor publications, as well as an overarching technical package for road safety, all of which can be downloaded from WHO's website. When we look at road trauma, it's important to remember that when it comes to those aged 5 to 29, the young and the most economically active segments of our population, road trauma kills more people in this age group than any other cause. Certainly here in the European region, it represents about 15% of all deaths, and this is a pattern that is not just limited to our low and middle income countries, but consistent to our high income countries as well, right across the countries of the region. When in looking at some road traffic mortality rates, specifically from national death cause registries from different countries, it was particularly interesting to note the difference in road traffic mortality rate between the Australian state of Victoria and that of the United Kingdom, where it's where in Victoria's almost half that mortality rate of the United Kingdom. And I do believe that that the particular focus that the state has put on saving lives in this age group is part of that difference. So in looking at the rationale that existed in the in the early 2000s when a graduated licensing system was being considered. It was very clear that the drivers 18 to 25 years of age were very overrepresented in casualty crashes in the state. So this was the really the rationale that existed to adopt a graduated licensing system in the state to really prepare drivers in the most progressively and sequential way possible to prepare them for operating a vehicle on the state's roads. In terms of the components, the elements are very similar to that of the New South Wales system, which I believe you've already experienced, but certainly in its first 10 years of implementation, very successfully reduced casualty crashes in this 18 to 24 year age group by more than 42%, which is a very significant outcome, and one that I think certainly could be replicated in other contexts. Full evaluation of this graduated licensing system has been undertaken by Vic Roads, and all of these reports are downloadable from Vic Roads' website. I wanted to, in concluding, I wanted to take the opportunity to highlight one particular element of the graduated licensing system, which was in relation to alcohol. Looking at this will be well known to many in the audience, but the casualty crash risk associated with alcohol increases with blood alcohol concentration, and with most jurisdictions in Europe and certainly in Australia, the level for the general population is 0.05 grams per deciliter. When we look at alcohol attributable fraction within the region, we see that about 35% of road traffic deaths in the region are causally associated with alcohol, and so this is really a significant and major risk factor that through stringent enforcement and the legislation can be prevented. One element of the graduated licensing system in all Australian states is that learner and probationary drivers are required for the first phases to have a blood alcohol concentration of 0, which in the final P2 stages increases to 0.02 grams per deciliter. And this is a really important tenement of the graduated licensing system, and is based on this research out of New Zealand that highlights the combination of alcohol impairment and inexperience increases the risk, the casualty crash risk. In the case of the Australian context of 50 milligrams per deciliter, a driver in a novice driver is approximately 5 times more likely to be involved in a casualty crash compared to a driver who is over the age of 30 and more experienced. If we look at the UK experience at 80 milligrams per deciliter, this pattern is continued and consistent with a very significant difference between the crash risk at 80 milligrams. A 15 to 19-year-old driver is 80 times more likely to be involved in a crash compared to a driver at 30 years of age who has had no alcohol. The public perspective on these blood alcohol concentration legislations is part of the ESRA survey, and the details of ESRA can be obtained from this QR code here. But one element that was included in the ESRA survey was looking at public support for a blood alcohol concentration of 0. And when we look at all of the countries that participated in ESRA, the United Kingdom really does stand out in terms of the current blood alcohol concentration that is legally permitted and legally permissible for drivers, both novice and the general population, at 0.08 grams per deciliter. This it really does stand out. But what's also important here is that that public support for novice drivers to have to be restricted to 0 alcohol is very high at 80, almost 80% of the population supporting this important road safety policy. I will conclude there, and I wish you all very best for the further discussion in this webinar, and be very happy to continue discussing with anyone who's interested. My email address is included in this final slide. Thank you.
Thank you very much to Jonathan Passmore. Shaun Helman, are you there? Would you like to put your mic?
Yeah.
Hello, Shaun. Let's just tee up what we're going to see, because I think I probably will play a slightly shortened version of this, but you might like to explain to our audience my mad idea and how it happened and what we did last Friday.
It wasn't a super mad idea. It was a scary idea for me. So James suggested that we go and talk to some young people who, I think they were all sixth form students. Some of them had just started driving. Some of them were still learning. And the idea was that I sat with these students, and they asked me, as it turned out, really intelligent, really good, well-motivated questions about what a graduated licensing system would look like in the UK. And yeah, that's, I guess, James, what you're going to show now.
Okay, I'm Skylar. Can you please explain to us like your whole scheme and like what the idea is and what you're basically wanting to change?
Sure. Okay, it's a much bigger question than you might realise. So first thing I'd say is this is not my scheme. Okay, this is a scheme that is used all around the world. I think it first came into being in New Zealand in the 1980s, and then various other countries have adopted it. So Canada, all the states in the US have it, Australian states as well. Essentially, Graduated licensing is a way of better fitting the licensing system to how people learn to drive. At a very high level, that's what it is. I will get to specifics in a minute, okay? I just want to take a step back, though, and explain what the situation is at the moment and why we think it's needed, okay? So if I give you two numbers, 7%, no, maybe 8% and 25%, okay? Those two numbers refer to two important things in the crash statistics in this country, in the UK. So 8% is how many drivers on the roads are aged 17 to 24. And that's typically what we call young drivers in the crash statistics, okay? The other number, 24% it is actually, is the proportion of collisions involving serious injury and death that have someone of that age in them.
Because obviously if it's a collision with another person, that it could just be a coincidence that the other person who is younger is there at that time. Like, how can you put a limit on that?
That's an excellent question. So I'm saying that younger drivers are overrepresented in crashes, but you're right, they're not always at fault. However, when you look at fault crashes, I believe it's even more likely that the young driver is at fault. So it's a really well observed question, but actually the data suggests that, you know, at best it's equal. So it's not just chance that people who are new to driving are having more crashes than people who have more experience. And we've known this for decades. Like I would say close to a century now. You can find evidence going back to the 1940s, certainly on this.
My name is Dominic.
Dominic, good to meet you.
Pleasure. So how would you plan to actually enforce this scheme?
Yeah. So the enforcement angle of this is one of the very first questions that people often ask. So one thing I've had people tell me when I've spoken to people who live in countries where this kind of thing is done, they will say, so parents will say, it's wonderful, I've got a legal reason why I won't let my child do a thing, and that's much easier to enforce within the family unit. Young people will often say the same. I have a legal reason for not wanting to get into a car with somebody that I don't feel safe with. Yeah. So it's largely self-enforcing. Again, really long answer. I hope that's answered it. Is that okay, or do you want to follow up, or can I go to your...
Can I have a follow-up, please?
Go for it, Dom.
So if you're not enforcing the rule, and from asking everyone here at the moment, every single person in this room is against this scheme, do you really think that young people, not listening to rules as young people often do, will actually listen to the new scheme as it happens?
Yeah, so it's interesting you say every person in this room is against this scheme, because I actually don't know what you've been told about the scheme. So it might be that James has told you some version of the scheme that is not as acceptable as some others. When we talk to people at a national level and we talk through, if we do surveys, representative surveys of people, like thousands and thousands of people, what we typically find is about half of people support the general idea and about half don't. In other countries, when this has been introduced, you don't just do it overnight. You don't just say to people, this is happening now. You consult with people, you work through what the policies look like, and you find for any given country what it might look like for that particular country. And you reach a place where, rather than everybody just completely ignoring it, people see it as legitimate. And this is, again, what happens with all laws. Okay. So, for example, 20-mile-an-hour speed limits have been in the news a lot. They've reduced speed limits in Wales in many urban areas to be 20 miles an hour, not 30. Lots of people are against that. Lots of people are for it. The evidence tells us if you have 20-mile-an-hour limits around where people live and work and play and so on in roads, you get far fewer injuries, right? But it took decades to get to that point. And we've been having this conversation for decades, and I'm sure we'll be having it for longer still. But you are absolutely entitled to be against this scheme, and it's my job and well, really it's policymakers' jobs to make that work for people. So I can't say I'm going to convince you today, but there's lots of nuance here that we may not be discussing. I'd like to ask everybody in the room, just give me some reasons why you are against it.
So let's say, for example, that me and Eddie will both going to the same place and we're both driving. We'd both have to take separate journeys, and that, as a result, would be one more young driver on the road. compared to if we were to go together. And you also have to think about it's another car journey, which means more carbon emissions, more petrol's being used. So, yeah.
There are a couple of things there to unpack. One is the risk element. So 2 people on the road at the same time in different vehicles. Again, when we introduce this policy in other countries, I've maybe not said this yet, you see reductions in fatalities and serious injuries in the age groups we're talking about, and then in the new driver groups of between 20, 30, 40%. Now, that may not sound like lots, but it is. It's huge in road safety. There's almost nothing in road safety that gives you that kind of return on investment. And think about it, if you had a new drug that cured 40% of cancer, you'd probably think that was a drug worth investing in, right?
Have you taken in the factors there, maybe like young parents, so if people have had children at like a very young age, like teen pregnancy, and they have to take their children to school, because you're saying the young age is like 17 to 24, if they can't have people of certain ages in their car, does that include like children?
No, so what we generally find is we have exclusions or exemptions for certain types of journeys. So for example, if one of you was going to work or coming to college at the times that you weren't allowed to drive according to the law, you would just have an exemption for that. Those are not the kind of journeys we're trying to control. The types of journeys we're trying to control are more the social situations where people are out driving with their mates that we just know are high risk through no fault of the people involved. It's not like these people are going out to try and take risks. They are just falling foul of that situation and their level of skill.
So you touched on the like socialisation part of it, and like a big thing for us as young adults, we're able to go out later at night and things like that, and we might have to take our friends to those sort of places, and that's a way of connecting with them. So I just want to know the socialisation side of it, and like how you go about changing that.
Yeah, so socialising is, of course, it's really important. It's really important for mental health as well. I would just throw a question back at you, right? I can't remember. Have you passed or you? Yeah, right. Before you passed, could you take your friends somewhere? No. So it's really no different. It's just slightly shifting that back in time. So the mental model we have at the moment of passing the driving test is that gives you the skills you need to be safe, essentially. Okay, so I can tell you one statistic that shows you that that's not true. Who do you think has the highest pass rate on the driving test, the practical driving test? What type of person do you think they would be?
Wasn't age?
Age and gender. Young men, spot on. Young men pass the driving test with a pass rate, it's about 5 percentage points higher than young women. And that's true. And by the way, I have no idea why this is. We need some research into this, right? But essentially, across the entire age range, men, as coded in the databases, are roughly 4 or 5 percentage points above women in terms of pass rate. Okay, which demographic out of those two do we think is more likely to be involved in a serious or fatal injury collision? Men, overwhelmingly men. So, does the argument that passing the driving test hold up when we consider that fact? I don't think it does. I would like to see you being able to socialise safely at a point where we are much more confident than we are now that you have had the chance to acquire the skills to keep you safe. You can never be 100% safe, but it's just, as I said at the beginning, about matching the system to how we know people develop and learn skills.
I'm Stefan.
Stefan.
I guess my question is quite long, but in 2022, I got a statistic of mine. 0.21% of the UK population was involved in a driving accident, and that's from the Department for Transport. And we're targeting 24% of those serious collisions. And then you said yourself, we're only targeting journeys where like you're socialising, so not like going to the shops or anything. So we're targeting 24% of 2.1 or 0.21%, and then you're targeting an even smaller percent of that. So why all these resources, or why changing regulation for this when we're affecting like 10% of 24% of 0.21%?
Mm-hmm. The one way of thinking about this is what is the return on investment? And there may be areas of public life that we could save more lives. You're absolutely right. Is that what's motivating the question partly? Okay, So there's always that return on investment numbers game to this. There's something else, though, going on here, which is that the people being killed and serious... And by the way, when I say serious injury, I don't know if any of you have had experience of somebody being in a collision and having a serious injury. I have. One of my friends from university had a motorbike crash. She was pillion on a motorbike, and a van pulled across the path of her, as it turned out, very inexperienced boyfriend who was riding the bike. She's now had 25 years of essentially constant pain. Right? These are injuries that can be not just serious injuries on a spreadsheet somewhere, that are life-changing.
My name is George, and I really wanted to consider, because obviously in the first few years of this coming out, I'm sure there would be a few people thinking of driving who would then decide that they didn't feel like with that policy they'd want to drive anymore. And obviously that would take from like the driving instructors, that would take from their earnings, they'd probably take from like the things they pay, like all the insurance and all that stuff, so it would take away economically. So do you feel like it'd be worth putting off some drivers losing out on money to then make a small percentage safer?
Right. The first thing is driving instructors would benefit from this, because, okay, here's a thing that's going to blow your mind. If you take people who have had formal driving instruction and you look at their safety record after they start driving, and you compare them with people who have not had formal driving instruction, in the broadest sense, they are no different in terms of their safety, right? However, what driving instructors are very good at doing is giving you a structured learning process to get you to the point where you need to be in terms of the skills you need to learn.
42 is an average.
It's good that you did a block of tennis.
Put your hand up if you feel that you've at least learned something more than is in the sheet that James sent you. Right, okay, so I've done my job. That's all I wanted to make sure I did. Have any of you changed your mind in terms of thinking, yeah, this might work? Or are you all still firmly anti? Okay, so some wavering of hands, that's fine. Stefan, is that a hand to say you have, or you have them all?
I guess so, because all the exemptions, I mean, it's not really going to hinder us, and it's just...
Okay. Any final observations from people rather than questions? Okay.
When do you think it will be like put into place and like properly?
I don't think it will be put into place. So I'm here to say this is something that we know would save lives and would make everyone safer, but basically it would just be a better system than the one we have. It's not up to me. I'm a researcher, right? I research things, I give facts to policymakers, and policymakers make decisions. I can say to them what I think I would do. It's not for me to make that decision. So I'm just here to tell you, hey, here's the thing. Yeah, there's lots going for it, there's lots against it. When you work it out in the round, I mean, every other country that's introduced it it's stuck.
Yeah. So why hasn't this been put in place already then?
That's a fantastic question. In short, nobody has had the political will to do it, and that may be because we've not presented the evidence strongly enough. It may be because people feel that the public don't want it. But actually, if you look at all the proper surveys on this, most people say they do want it. So, yeah. Short answer, I don't know. Sorry about that.
The interesting thing is, if this was introduced 5 years ago and you were brought up with this as a scheme or as a policy, every single one of you in here would follow it.
If it became a law, then we don't really want to break the law as well.
That's the point.
And there is system thinking, but it needs to be a law that people see as legitimate.
Shaun, you've recovered from that now, I hope.
Just about.
I mean, it's really interesting, some of the things that they said, and there were so many different angles that they drew on. What did you take away from it when you were heading away from there on Friday? What was uppermost in your mind?
Uppermost in my mind was the fact that I think that the people who would be affected by this the most are willing to ask really intelligent questions with the purpose of finding out, not the purpose of just dismissing it out of hand. I mean, they did say at the beginning, actually, everybody in the room said, oh, we're all against this. But actually that attitude I felt softened throughout the discussion, and there were lots of light bulb moments. Like, I don't think, for example, people realised that just because you pass the driving test means you're safe. I think that's a mental model we see in the young driving public. or in the driving public, is that once you've passed your test, you are safe. I think that was challenged through the discussion. So yeah, it was just interesting. And I think, dialogue like that is really important. That's what I took away.
Shaun, thank you very much. Stay where you are. Could I bring back Sarah, please, and Bernard Carlon and Sarah Jones? And I hope Peter Baker has been following the chat function, because it's been really busy. Lots of questions and comments. Peter, can I hand over to you to facilitate the last 10 minutes for a little catch up and some takeaway points and some where next type discussion.
Yeah, so we do have a list of vehicles that on a power to weight ratio have, essentially been banned for novice drivers, P drivers, PPO drivers. But there are many of our full electric vehicles which are not on that list, which are available for PPO drivers to use. And so, look, on balance, we know that because of the risk taking, as well as the sort of basic vehicle control skills that and hazard control skills, that keeping young drivers out of high performance vehicles has a really big benefit associated with it. And I just popped in the chat as well, just a very quick back of the envelope, the calculation just for the fatality cost benefits in Australia for around $2 billion in the last 5 years, when compared to the fatalities which we had pre-GLS. So like the cost benefit of reduction of that level of trauma is really significant. And I'm sure Sarah would have a lot to say about the impacts on the health system, let alone the emotional impacts that it has on communities and families. Yes, so there are apps available. We have authorized apps which clearly make it a lot easier for logging those hours, but we also have a manual logbook which needs to be signed by the supervising driver on every event, so every trip, and they must record the details of where they travelled and the time expended, etc. And so, yes, it does rely on responsible adults, but when we've surveyed parents in particular, they're really concerned that they want their young driver to be a safe driver. And really, when you sit in those groups where supervising drivers' parents are actually talking about the level of skill that they see in a younger driver, they really recognise that you need that amount of time, and you need to get past those vehicle control skill period, which is now up to 50 hours, and then sort of the hazard perception and those other protective driving sort of habits are able to be more experienced by the younger driver, and they become safer drivers as a result. And the proof is in the crash rates.
I think that's critical, and I know Dr. Big, when I spoke to her, was adamant. We needed to talk about permission, not restriction. Because this is not about restriction, and I think it's important as well to remember there's lots of talk about what young people are and aren't, in this case, being allowed to do. But it's not just young people and the people who are in a car with them who are killed and injured in road traffic collisions. There are other road users that also suffer significant injuries and fatality in the same collision, and they have permission as well. They have permission to live their life and drive in an environment that's as safe as we can make it. And actually, graduated driver licensing is about making the environment safer for everybody within it. And so, yes, it is important to talk about permission, but it's also important to talk about the fact that this isn't just about young drivers. This is about everybody else in the road traffic environment too.
I was just hoping to add to that, because I think something we don't talk about enough is the fact that we already have a system that has the kind of philosophy that we're talking about built into it. You have a driving test, right? You are restricted from driving. You are restricted from expressing your freedoms until you pass the driving test. All we're talking about doing is making that tool more effective and better suited to how people actually learn skills. That's all we're talking about.
I think if you look, so I'm sitting here in Wales. Previously, the Welsh government has made a commitment to calling for graduated driver licensing. Wales doesn't have the devolved power to do that, and the same in Scotland, where they've repeatedly looked to introduce graduated driver licensing. And if you think back to my slide, it was Wales and Scotland that do have a greater young driver crash issue than in England. But I do feel that it is important post-COVID to reduce the burden of young driver crashes on health and health services.
Look, I think the reality of the overrepresentation of young people in trauma was palpable, and we still have, in spite of that 55% reduction that we've seen, young people are still overrepresented in road trauma in New South Wales. And it was at such epidemic levels back in that pre-2000 period that there was significant call on really upgrading the system so that we could learn from other jurisdictions. I mean, there are other jurisdictions that commenced before us. Victoria, another, one of our state colleagues actually commenced slightly before us as well. And so we learn from each other. And I think that's the beauty of sort of the sharing this sort of information across borders around what are the measures that actually work to make it really effectively reduce the burden of trauma on the community. And certainly as we have gone through that period from the introduction of a GLS at 50 hours to now 120 hours, where we've had tragedies that actually also have marked that calendar in a way that call for the community's wants to see us act on reducing trauma. You need to be ready with the research and the information and the tools. And I think that's one of the really important aspects of sharing this information today, but also the journey that we've been on in Australia in sharing what works across the different jurisdictions and being able to leverage that politically and make those changes happen when the opportunities arise.
Yeah. I've just written a short reply to that, but this was a question that was asked in the group of sixth formers, which I thought was really interesting. It's more complicated than just looking at the numbers. So the thing about motorcycles is they're a cheap, affordable mobility for people who are very, very young. That in itself is slightly odd, that we take people who are at the highest risk period of their lives in terms of sensation seeking and various other things, and put them on the highest possible risk mode of transport that we can find. But look, that's a trade-off that's been made, hasn't it? Right? Can we do more to protect motorcyclists? Probably yes, but it's a lot of it's got to do with designing the wider safe system approach around them. So for example, in countries where motorbikes are much more numerous on the roads, you tend to see a lower risk per motorcyclist, a lower risk overall in some cases. So there's a lot to be done there. Probably we should be looking to have a graduated approach to all transport modes that, again, match the system to how people learn the skill.
That sounds very posh, Peter. I'm here on my home. Oh, the studio. Right, look, thank you very much. What I just want to do is to bring this to a close. We only have a couple of minutes. Bernard, would you like to just summarize, your advice to us? Are there 3 or 4 key things that you have learned in your journey with graduated driver licensing? What are the key things that we should be focusing on now? We being those who are committed to it and would like to see it introduced in the UK.
Yes, I think there are just some very basic principles around, firstly, having the evidence base to mount the arguments, both economic, socially, and from a trauma perspective, so that you're well equipped for the discussions that need to be had with political leaders that actually will end up making the decisions ultimately. So I think having a very strong evidence base that really clearly identifies the whole community benefit for these sorts of measures, doing what you're doing, reaching out to other jurisdictions and actually getting it has been done, it has been successful, it does save lives, and I think as well, in our experience, having advocates from those people who are affected by trauma, but also young people themselves. And I think fantastic job done in actually engaging in this webinar with young people themselves, because really, they see the sense in much of this as well, and they, they're not all tainted with the same sort of perspective that the media might paint them as. And there's a lot of, I think, very strong advocates for these sorts of life-saving measures amongst young people, and that we should be engaging, giving their voice as well as part of the equation. And also starting off at a point, looking to the long-term sort of safe systems approach to each of the elements of the system that can help protect young people as they journey through their learning to control a vehicle, and then having the skills to be able to protect themselves in a vehicle as well as the rest of the community. Having that longer term view and being ready, I suppose, for, as you could see on our timeline, we weren't at the exemplar level when we started back in 2000. We're at a very standard level, but we've been able to build consistently based on the evidence of others and the research that we've done ourselves to move us along that dial. And I think that's really the long-term efforts that you need to actually put in to garner support for these sorts of reforms as well is really important.
Bernard Carlon, thank you. Final reflection from Shaun Helman.
Bernard said it all very well. I would add we should stop talking about whether we should do this and start talking about how.
Well, I think you have a virtual room full of supporters. Thank you very much, everybody, for staying on, and apologies for my technical inadequacies, and particularly apologies during the school filming. My the stabilization feature on the camera stopped working, so it might have made you all feel very bilious watching that. But thank you for bearing with us. The full version of this, including Jonathan Passmore, will be posted on Project Edward, and I'll send everyone a link so you can watch it. And thank you for your engagement. Please stay tuned. We've got a program of webinars coming up over the coming months. You'll be very welcome to join them. But meanwhile, thank you to Dr. Shaun Helman. Thank you to Bernard Carlon. Thank you to Jonathan Passmore, who sent us the video, but we will use it. And also to Sarah Jones. And from me, James, and the Project Edward team. Cheerio, and thank you very much for joining us. Bye-bye.
Thanks, James.
Bye, everyone.